All right, good morning, everybody. It's 9 o'clock, so we're going to go ahead and get started. Happy Thursday. We know it's the first day back for students for some schools, so appreciate everyone taking the time to be with us this morning. Here's our agenda for today. We have a couple of announcements. We're going to go over our COVID data, quick review of the guidance, and then we have our new website to introduce to you, and that should be about it for today. So really, just two things we want to share right off the bat. So case reporting, currently our teams here are in a testing phase for a new system for schools to report cases to the health department. This won't be ready until next week, and so we will be rolling this out early next week. For the time being, if schools need to report an outbreak, they can still do that by emailing epi@pima.gov. We'll be sharing that information out in the follow-up email, but do want to give everyone a heads up that a new system is going to be introduced next week. We do realize that case reporting can be a bit of a burden on schools, but we do just want to stress the importance of that data for our health department and tracking COVID in our community. And then the other announcement is just regarding our team. We have sorry, I'm going to mute a couple of folks here. There, just getting some background noise. Our team has changed just a little bit. Connie Johnson is no longer with us. Sylvia Vasquez, who's been with us throughout the whole pandemic, her last day is tomorrow, and so we're bidding her farewell. And then some of you may remember Erica Spence. She helped a lot of schools out with testing processes and protocols. She also moved on from the department over the summer. We did welcome a couple new folks to our team. So Candy Pipes is administrative specialist here on our schools team, and then Mariana Singletary is with our epidemiology team, and some of you may have worked with her already. So here's our team, what it looks like currently. Kat Davis continues to be our program manager for health justice and intersectional populations. That's the kind of umbrella program that sees the schools team. And then I know most of you, so my name's Matt. I'm the school's program manager for youth and school communities. And then Candy Pipes is our data and administrative assistant. She's the one that's been sending you the follow-up emails that compile all the information that we're trying to get out to schools. And so currently we're recruiting for a few more members of our team to support you all. We're looking for a school support specialist. That job has been posted. And then soon hoping to recruit for a school health liaison. And we're also hoping to host a couple of AmeriCorps on our team also that'll be doing some work with the schools. I also wanted to just introduce a few folks on our EPI team. So Matt Christenberry, Mariana Singletary, and Anissa Taylor are three of our celebrity epidemiologists here at the health department that often get called upon to help schools out that might be dealing with outbreaks or might have questions regarding their mitigation policies and protocols. And it's not uncommon for them to join these meetings and answer questions in the chat. Getting into our COVID data, so county still remains at the medium level. However, we're continuing to experience a high rate of transmission. And so that case rate has gone up a little bit from the previous week. As far as vaccines, we're seeing about 49.2%. That's up 0.2% from the last time I presented. We're still encouraging students and families to get vaccinated. In fact, ADHS is sponsoring a lunch and learn session tomorrow for any school district staff, administrators, nurses, health staff that are interested in attending that. That'll be at 1 o'clock tomorrow, and we're going to be sending out the details in our follow-up email. I also just want to note that this data gets updated on the CDC usually on Thursday afternoons. So it's not the best timing for these calls because it's about a week old, but if you ever want to check it late Thursday afternoon, you can go to this link and you can see the updated numbers. A little bit more information on our community level here. Case rate has gone up, like I said before. Admissions and inpatient beds being used, those dropped slightly, but not a whole lot, maybe a couple tenths of a percentage is all. I wanted to share what the map looks like. This just kind of gives a picture of what our country looks like right now. You can see Arizona is mostly red. We're in the yellow down in southern Arizona. But if I move over to transmission levels, we're not doing so hot. We're still in very high transmission. And so this is why mitigation is still really important. So when it comes to our mitigation guidance, we reviewed this the last couple of weeks, but here it is again, encouraging everyone to stay up to date on vaccinations. Again, up to date means that an individual has received their eligible boosters. Encouraging anyone who's showing any type of symptoms to just stay home when they're sick. Optimize ventilation and improve indoor air quality in schools and classrooms. Reminding everyone of hand hygiene, basic things like covering your mouth and nose, cleaning and disinfecting. Indoor masking is encouraged in schools, but especially during high community levels. And so we want everyone to think about that. If Arizona were to move into a high community level, how might masking look at your school? And then screening testing. Now would be a good time to be implementing screening testing as students are coming back into school from the summer and traveling, but also implementing some sort of screening testing around high-risk activities, such as indoor sports or those extracurricular activities. And this is really recommended when we're in the yellow and red. All right, we did change our website, and so I'm going to show you in a bit, but if everybody wants to just copy this link, that will, and save it. That way it'll be easy to find, but I'm going to go ahead and share my screen here so I can kind of walk you through where to find this information on the new website. So it looks a little bit different. Hopefully it looks a little better than it was before. But really, we're continuing to build this out. And so this website is really meant to kind of be an access point for all of the services and programs that the county health department has to offer for our school communities. So we're continuing to work with our programs to share information. For right now, we did start putting up a few links, but I want to draw your attention to the one that says COVID-19 school resources. So if you click on this one, it'll take you to our school COVID-19 resources. And so here we've tried to break down the information a little bit easier for you. A lot of these will take you to CDC links that will update as the CDC changes things. And we'll also be monitoring that too to make sure that we communicate once we see changes are made, if they're made. And so there's questions here. You could also, point families towards this page too if they have questions on what schools are supposed to be doing when it comes to masking and testing and isolating and quarantining and all of that. Now at the bottom, there's a couple of colored boxes here. And if you click on the blue one, this is specific to school staff. And so this is where you're going to find your links for ordering test kits for your schools, the form for PPE supplies, if you'd like those. We also have the link to schedule a vaccine clinic through PMG. Our contact information is here if you forget it. We have a document library. We haven't uploaded anything in there yet, but we might as we find helpful resources to share with you. And then here where it says report an outbreak, this is the one that I mentioned. This is going to be changing next week. But for now, if you do experience an outbreak in the next week, go ahead and report it by sending an email to epi@pima.gov, and someone on their team will take a look at it and might be in contact with you. Once this changes, you'll see a link to a form where it's going to ask schools to report case counts. And so that's just simply any time that you're made aware of a positive case in your school, just letting us know so that we can keep count of those. So that's the new website right now. If you think of helpful resources that you would like to see on the website, please shoot us an email. We want this to be a helpful resource for folks. And so happy to entertain any recommendations for what we can include on here. And that's about it for what I have to share with you all, but happy to take questions if anybody has anything that I missed or need a refresher on anything.
Hey, Matt. This is
Hi.
Joseph Gall from TUSD. How are you?
Good.
So, real quick question. So the calculators that the CDC has on their website for how to, if I'm up to date and if I need to quarantine or isolate, stuff like that. Are those embedded in this website?
We don't have it embedded on the website. I could ask our webpage developers. That's a good idea if we could just embed that tool to make it easier for y'all to find. If that's something that
because here's why. I am really trying to push the school district to not rewrite their own guidelines based upon what the CDC is saying and such. If we can just kind of embed this into your website, we can create policy that basically says we follow the guidelines from this particular site.
Gotcha. Okay, yeah, let me look into that.
It would make it a whole lot easier. And then if people come to our service line every day asking, well, if I have this, do I qualify? If I have this, am I up to date? We send them to this one location where they can self-assess themselves.
That makes sense. Right now, currently on that main COVID resource page for schools, there's a question that says, what's the current guidance for quarantine and isolation? And then there we have a link to the CDC that opens up the information about the calculator. I can ask if we can embed the actual calculator. I'm not sure.
So the CDC website actually allows you to embed without permission. So if you read the very small print at the bottom of the calculator, it says, go ahead and embed it in any website you want.
Okay, all right. Well, thanks for the suggestion. So you know that. We'll look into that. Yeah, absolutely.
Sure.
Thank you. All right. Does anybody else? I need to look at the chat, I suppose. There's probably questions popping up in the chat. I'm just going to ask my team who's been monitoring the chat if there's any that I haven't addressed. If you just want to shout them out, I can take a stab at them.
Hey, Matt, it's Kat. I have been monitoring the chat. I believe all the questions have been answered. At this point, there was a question about, do we need to report outbreaks or report all cases? For now, report all cases, and we will have a lot more details for you next week when hopefully this new reporting tool has been launched. We'll be able to kind of walk through it and talk about how to report things. So I know it's not convenient, but bear with us just for one more week. And then Chad just asked if we are doing contact tracing. So I was just writing a response to him. We are not requiring contact tracing. If you choose to do contact tracing within your school, then that's great. That's just going to help protect your students and prevent outbreaks. So if you would like to do that and require quarantine for those who have been close contacts, then that is up to your school or district policy. That is not something that we are able to enforce. So I would speak with your school administrators or district administrators to see what they want you to do about quarantining, isolation, all of that. So we have the CDC recommendations. We're happy to review policies that you all write. but we do not, we're not enforcing that any longer. So hopefully that answers your question. And then Yvette asked, do we report cases where parents call into the school stating their child tested positive? So you should report that, but in that case, you can just report the number, say we have one case. So the idea is that we want to figure out when we need to step in and offer support and that kind of thing. So you can just tell us we have a case. You don't have to give us all of the students' identifiable information in that case. And then Dr. Ga is also asking if we can include the reporting your home test results on the school website. So we can talk to our IT team about that as well. So hopefully, is there?
Yeah, so my team kind of tests like practically every day in some cases. So we want to make sure that we are supporting your data validity. So we're having them submit those results, negative or positive, but the issue is that it's like 5 or 6 screens to go through. So I'm wondering if there's a way to get a shortened form where we can give the basics and not have all the added extras in there, if that's possible. But if all the data is actually needed, then so be it. But you know what I mean.
Is this for the home test result?
Yes, and it's very hard for a person to actually find, by the way. So if we can put a button right there on the school thing, nice and big and bright, and say, report your home test results, that'd be great.
Yeah, we can definitely work on that. As far as the test result, like the data collection, I believe that it was designed by our epidemiology team. So I'm not sure how much we can take out of there, but we can definitely make it more accessible on the school's page.
Plus, is there a way to, so if a person reports a positive home test, is there a way to get it to finalize a web page where they get the treatment process if they want it, if they qualify for it and such, because we want to give an incentive as to why you would report your positive, and we're not going to be knocking on your door and stuff like that. But here's the plan that could potentially help you get out of this faster.
Yeah, so I think what we'll do is we'll have a conversation here with our teams. We have a team that's dispersing the home test kits and tracking those results. And then our EPI team has created a new form that's for schools to report their cases. And so we'll talk about how that data, one, needs to be integrated, but also how to make it much easier for people. And then I hear what you're saying about, so one, making it easier to find where to report, and then once they report, getting them the right resources that might include the treating options. So yeah, we'll look into that, and Dr. Ga, we can follow up with you on what we hear and what we can come up with. Yes, one-stop shopping. And that's the whole idea of our new website too, is we want to make it convenient. So, and then, yes, please also report positive cases for staff or anyone working in the school. Great. Any other questions? Okay.
So Matt,
I know, yeah.
One last comment, if I may. I don't think you guys get this as often as you probably should, but So I thank you and the team for all of your hard work and the large amount of effort and time that you have put into helping our schools stay safe and always being available to us. So please know that what you do is valuable and we recognize it and we very much appreciate your team. So thank you so much.
I appreciate you saying that, and I'll pass that along to the rest of the team here. So thank you, everybody. I know this is a big day for a lot of folks, so good luck. We wish you the best, and we're here. We're around to support you however we can help. So send us a message if you have questions. We'll see you next week.